Welcome to Expat Health. This is Dr. Mo, Digital Nomad physician, who also is along on the journey with all of you guys traveling across the world and trying to keep myself as healthy as possible. So a topic that comes up quite a lot is type 2 diabetes or prediabetes. Let's dive right in. As we get older, I guess it's normal for our metabolism to slow down, for our muscle mass to decrease, and many of us find ourselves being more sedentary. And all of this definitely contributes to the increased risk of both prediabetes and diabetes. One thing that I think gets missed a little bit in Western medicine is prediabetes and diabetes aren't just conditions that are met based on some numbers, right? Each and every human body is going to react very differently. Some people with a blood sugar of 5.6 are already going to display signs and symptoms of prediabetes. I don't want to get too much into the weeds, but prediabetes is generally not diagnosed until your hemoglobin A1C goes or peaks above 5.7, or you have a fasting blood sugar of certain number, which again, I feel like if I get into those details, I detract from what I want people to understand about type 2 diabetes and prediabetes. It is a certain gradient that matters. Sure, I can diagnose you with type 2 diabetes as soon as you have a blood sugar over 200, which is done fasting. But number one, I don't want to wait until somebody becomes a type 2 diabetic, and I don't want to catch someone when they are a pre-diabetic. The goal is to not even get close to those ranges. So let's review. What are the most powerful ways that we know to prevent type 2 diabetes and to manage either pre-diabetes or type 2 diabetes so that it doesn't progress? And how could it progress? Well, we know that prediabetes often progresses to type 2 diabetes, or if you've had gestational diabetes, it can progress, or you're at least at a higher risk for type 2 diabetes. And the reason is that the insulin production usually increases. How your body responds to this hormone created by your pancreas, usually becomes less responsive. And so you have to create more insulin to control the blood sugar that goes throughout your arteries and veins. With only about a teaspoon of sugar that normally courses through our veins, it only takes an extra teaspoon for you to be completely out of whack, for everything to start going haywire, for the eyes to be affected, for the blood vessels in the pelvic organ to be affected, for your gut, for your intestine, for everything to start malfunctioning. Fortunately, our bodies have the capability of managing this blood sugar quite well. So the pancreas can release more insulin or another hormone if it gets too low. And our muscle tissue can absorb a lot of the insulin, blood sugar, and our livers can also store some of the sugar that's floating in the body so that it doesn't get too high and damage the normal tissue. With my own patients, my goal is to get their muscles and their liver and their intestines and their kidneys to be as efficient as possible when it comes to managing blood sugars. Starting with the muscles, I do like that my patients do cardiovascular exercise, but it is very important that they also do a lot of resistance training to have as many active muscle fibers as possible, which really can be effective in managing blood sugars, especially after a very heavy sugar carby meal. I like for them to go for a walk. I like for them to get some activity in, and that definitely drives down those blood sugar numbers. For those with really crazy, wild fluctuating numbers, I have them wear a continuous glucose monitor. At least that way we get a sense of how bad they respond to certain foods or to certain foods at certain times in the day. The kidneys can be sensitive to excess salt intake. Now, maybe salt won't raise your blood pressure. Some people just don't respond to salt in that way, but it can interfere with the way your kidneys function, and it can interfere with the way your kidneys clear blood sugar. And so for that reason, staying hydrated, making sure that your blood pressure is well controlled so that your kidneys can function well, and avoiding excess salt is a very critical part of making sure that the blood sugar control in your kidneys function top notch. With liver, my big concern is fatty liver disease. So if anybody has a triglyceride anywhere above 70 or 80, I start thinking about like maybe they're having a little bit too much carbs, maybe they got some signs of fatty liver disease. That is not always easy to diagnose, but we usually check AST, ALT, liver functions. And again, I don't want to get into numbers because it's always different for every person, but we want to see those numbers to be quite low, 20, 30 tops, and usually even lower with the AST and ALT numbers. We might even get an ultrasound to look for fatty liver disease. And there are other tests that we can do to determine how well the liver is functioning at making sure that your blood sugar is well managed through the storage function of the liver. And I know there are some terms out there regarding the intestines, gut permeability and all that stuff. To me, some of these terms can be misleading or they can be a little bit gimmicky. Not trying to berate anyone, but I think what matters is your gut should function well. The bacteria in the gut should be able to break down foods in the most efficient way in order for your system to function, and it is an individualized process. My goal is to make sure that my patients have a really good intestinal function. I want their large intestine to do its work with all of the good healthy bacteria that are there. I want the small intestine to absorb things at the right rate so certain sugars aren't excessively absorbed. I want the stomach to do what it's supposed to do. All of that is critical. And a lot of the function of the gut has to do with the kind of foods you eat. This is not going to be a talk about keto versus vegan versus vegetarian. What matters is that the diet that you have feeds the gut bacteria the way it should and helps your intestine function the way it should. Finally, I will add one other aspect to the blood sugar equation, which really is the stress level and sleep cycle. For some of us, we are very sensitive to stress, and some of us are not at all. But when we are sensitive to stress, a little bit of stress spikes up our blood sugars. For some people, chronic stress really shoots up their blood sugar. So it's not about avoiding stress. To me, it's more about coping with stress. And there are many ways to cope with stress. Probably the most important way of coping with stress is to have a way, an outlet for you to be able to release the stress, to be able to think through all the things that are adding to your anxiety level and be able to make sense of it, come up with a plan, and in the end, essentially just feel in control. The other side of this is sleep, insomnia, whether insomnia from stress or just genetic insomnia, you just don't sleep well. But there are still ways of making sure that this insomnia doesn't affect your blood sugars. A lot of my patients might initially reach for hypnotics, so basically Ambien, Trazodone, all the different medications that are out there. But we always try to reserve that for emergencies. Let's just say that the majority of the time I try to get my patients to use many other modalities, from hypnosis to cognitive behavioral therapy to many other things, before they reach for medications. And when the medications are needed, absolutely, they have a great place in Western medicine, but they shouldn't be the first thing that we go to. So guys, I hope I gave you a good understanding of my frame of thought when it comes to blood sugar management. The goal is to never have you be anywhere near prediabetes. The goal is to prevent diabetes. And if you have diabetes, the goal is for the diabetes not to progress, so you don't have to be on insulin. And for our pre-diabetic individuals, there are wonderful programs that we have come up with that I think are pretty effective in helping you manage any kind of blood sugar numbers. Hope this is helpful. Leave comments below. Thank you for listening. Take care.